Hello, Loving Health community. My name is Kate and I'm the founder of Loving Health, and I started this company to help the consumer of healthcare, you as the patient, take charge of your own health and to protect yourself, to learn how to protect yourself in this system that we are in. I know there's a lot of different opinions about our healthcare system and what is the best route for the role of the doctor and the role of the patient in healthcare. But it is my opinion that it's the dynamic between the patient and the doctor that really makes the most difference in healthcare. And in my opinion, there is a way for the doctor and the patient to have a great relationship, to both be informed and to work together to find the best course of action for the patient. So I've talked about my company, Loving Health, a little bit here on this channel, and if you want more detail, you can go to our website, lovinghealthforme.com, and I wrote a whole section on my goals for this company, what I want to do with it in the future, and why I created it, why I thought it was necessary. I have learned throughout learning about nutrition and health and applying that to my own life and fixing up my own health and seeing how much of a difference diet and lifestyle can make in disease prevention, in disease treatment, in disease management, that I want to be a resource for anyone that needs help out there. I want to be part of their treatment team. I do not think that Western medicine is useless or that it has been ruined. I think there are wonderful parts of Western medicine, of conventional treatments as well as natural treatments, that can all be incorporated together. They can work synergistically, they can be used as adjuvants for each other. I think we should take the best parts of each different section of healthcare and combine them together to just make this elevated experience for the doctor and patient and just whoever is involved with that team of figuring out a diagnosis and treatment plan for an illness. And I think now more than ever, with what has been going on in the world in the last 2 years, according to this date, February 1st of 2022, for the patient or consumer of healthcare to be informed. To not only be informed, to be armed with information, because I think there are downfalls to the system. Specifically with healthcare professionals, I think that some healthcare professionals can get too laser focused on everything that they need to do in order to do their job correctly according to hospital protocols or top-down authority. So just checking boxes, not really spending enough time talking to the patient, figuring out their history, figuring out their stress levels and sleep schedules and mental state, and just really how they feel about their treatment and if they think that their treatment plan is going to be doable. A lot of prescription medication is stopped voluntarily by the patient because they can't handle the side effects, or they don't remember to take it every day, or it's just not doable within their lifestyle, and the doctor, just says, here's this medication, here's what you need to do, anything else that they may prescribe, and they're like, go do it. And then the patient is on their own from there. And sometimes it can be really overwhelming. Anxiety or depression can play a part in chronic diagnoses, and you just need help. You need help figuring it all out. And so especially with what's been going on in the world, I feel that healthcare has become so laser focused. There has been a sort of cancel culture in healthcare where if you do not follow protocol exactly, this top-down direction, authority is telling you what to do, you will kind of be purged from the system. And we have seen this with doctors who, not even that they are telling their patients or encouraging their patients to take a different route or a different course of action, but they're just respecting the patient's opinion and the patient's choice to do to their bodies what they feel is best, because it is their body, this is their life, they are in full control of what happens to their body in terms of medical treatment. And when the doctor just respects the patient's choice, they can get their license taken away. People are tattling on them, they are reporting them to medical boards. I have seen a lot of this, even of doctors who are just like, you know what, I just respect everyone's choice, and apparently that has become a crime now. So unfortunately, those doctors have kind of become the example, and other doctors who may be like, you know what, I want to support the patient's choice as well, but I don't want what has happened to them to happen to me. And so they don't fight for their patients. They don't help their patients do what the patient wants to do. They say, you know what, this is the way it has to be done. I could lose my license, like I don't want to get in trouble with the medical board, and they sometimes respectfully, sometimes the patients to not return to their office to find a new doctor if they don't want to follow the protocols that the doctor wants them to. And I think that's not right at all. I think the patient has full bodily autonomy, and I think there is always a way to figure out the best course of treatment action for the patient, whether that is in line with the doctor wants to do, whether that is in line with what the government wants to do, whether that is in line with what the medical agencies want to do or not. So Loving Health has a free email newsletter. If you'd like to sign up for it, just send me your email at lovinghealthforme@outlook.com, and I will get you signed up for that. We send newsletters out every 2 weeks, and I write these newsletters to give you general information that I think can be really useful either now or in the future. So this week's article is called Informed Consent and Taking Control of Your Health. Choosing an intervention for an ailment or medical condition can be overwhelming, especially when the condition is severe or time-sensitive. This can result in relinquishing the decision-making process to a doctor or healthcare practitioner and consenting to what they believe is best. Having your doctor inform you of the treatment, procedure, or protocol they think is best, followed by signing a consent form, may feel like having received proper informed consent. However, this is only actually a small portion of what informed consent is. Informed consent is 1. When a patient is fully informed of the risks and benefits of a suggested treatment option, all alternative options, and foregoing treatment altogether, which is surveillance. 2. The patient consents to a treatment plan which, 3. is usually documented via consent form. Doctors or any healthcare professionals educating the patient on treatment options are ethically and legally obligated to give the patient full informed consent. The legal protections for principles of informed consent and patient autonomy began in the early 20th century, primarily with multiple court cases where doctors performed unapproved surgery on anesthetized patients. Specifically in the case of Pratt versus Davis, a surgeon performed a hysterectomy on a woman without her consent, later admitting in court that he thought she was unfit to consent to the procedure because she was epileptic. He also did not disclose that he chose to remove this woman's uterus as a way to treat her seizures. In a separate case, Rollator versus Strain, a surgeon removed a bone from a patient's foot despite the patient's preoperative orders to not remove the bone. In the final case, which legally established the principle of a patient's bodily autonomy, a woman was subjected to a hysterectomy when she stated she did not want it. The judge stated, "Every human being of adult years and sound mind has a right to determine what shall be done with his own body, and a surgeon who performs an operation without his patient's consent commits an assault, for which he is liable in damages." This unfortunate history of abuse in medicine has laid the groundwork for open discussion, trust, and enforcing consent in the doctor-patient relationship. Proper informed consent is achieved through a shared decision-making process. Discussion should occur at the patient's level of comprehension, and the patient and healthcare professional then make a decision together when more than one treatment option is available. However, the final decision for intervention is up to the patient, for it is their body which the treatment will be carried out on, and they will be the one that bears the benefits or the consequences of the treatment. This shared decision-making process should take into account the patient's unique preferences and values regarding their treatment and what they are comfortable with, what they feel is the best decision based on the available evidence. This means that even after the doctor has provided sufficient information and education on a treatment which they have concluded is the best course of action, the patient can still refuse the treatment or take another approach that they are secure with. If a doctor is uninformed about a possible alternative treatment, the patient should feel comfortable bringing its evidence to the doctor's attention and having an open discussion about the risks, benefits, and possibility of the doctor administering the treatment. Informed consent is properly obtained when the proposed intervention is fully explained to and understood by the patient. So layperson speak here, no fancy, intimidating doctor explanation for things. The patient's role in the decision-making process is acknowledged and it should be respected. Alternative treatment options to the proposed intervention are discussed, and a discussion has taken place of the risk and benefits of the proposed intervention, all alternative treatments, and foregoing treatment altogether, so watchful waiting or surveillance. The patient's decision is made and documented, and this is usually in a consent form. Patients have the right to receive informed consent. They should not feel confused or pressured when it comes to choosing a treatment option for their body. Doctors are very busy, smart, and usually well-intentioned people, but they should still make time to discuss the patient's options with them in depth, and they also don't get the final say as to what treatment is right for the patient. When it comes to medical care, finding a doctor that you see eye to eye with on every little thing is not necessary and can be extremely difficult. So a doctor is a good fit for you as a patient when you feel comfortable, heard, understood, respected, and can work with them as a team in the medical decision-making process. So a lot of people think, for example, for a plant-based lifestyle, they have to find a doctor that is plant-based. And that's not true. You just need a doctor that acknowledges that diet and lifestyle intervention is a valid evidence-based management or treatment strategy for a lot of diseases and will listen to you, respect you, hear you out, all of those things. Don't be afraid to ask questions and ask for evidence. This is a big one. Make your doctors provide the evidence. That is their job. That's not your job. Especially long-term research with hard endpoints like death or increased life expectancy. Dropping your cholesterol into the good range means nothing if your risk of a heart attack, which is the adverse event that can kill you, stays the same. So we don't want just markers to change and for you to have pretty blood work. You want your adverse events of the thing that can kill you to decrease. If your doctor will not provide evidence for a treatment option, you should feel comfortable providing them with your own research so you can discuss it together and see if that treatment can be a valid option for your specific patient profile. So it has definitely been a lot of people's experience that when they try to bring up a treatment or even come in with their own evidence and they're so excited, they did their homework, they did their own research, and they bring it to their doctor and they're excited to discuss it with them, and the doctor may get embarrassed or their ego is a little bit too big and they're like, I am the expert, how dare you bring this information to me? And the doctor just shuts them down or is angry and upset that they are trying to contribute to the conversation of what care they, as the patient, will be receiving. And if they do that, the doctor is not a good fit for you as the patient who wants to go this diet and lifestyle route. So for patients that have had negative experiences with healthcare practitioners, it can be easy to forget that doctors are people too, and we all have bad days sometimes. However, if you feel continually shamed, patronized, unheard, or disrespected by your doctor, it's time to find a new one. Don't forget that the doctor may be the expert, but they work for you. Being a quote-unquote good patient does not guarantee better health outcomes. In fact, the only thing it guarantees is that you'll be unquestionably compliant. And unfortunately, that doesn't equal getting healthier. Sometimes it just means you get stuck in the medical mill, where symptom after symptom is treated and pretty soon you're on multiple medications but feel worse than when you started, and somehow that one thing that you came in for is still an issue. In Kelly Turner's Radical Remission, Surviving Cancer Against All Odds, one of the 9 common factors of those who miraculously survived terminal cancer was taking control of their health. And for most of these people who had not just survived, but healed from their cancer when they were told that they were going to die, meant not following the advice of their doctor and following their intuition when it came to treatment instead. These survivors viewed taking control of their healing not only as good, but as something that was essential to their healing process. Simply put, quote, radical remission survivors are the annoying patients who do not automatically do whatever their doctors tell them to do, unquote. And that is a fantastic book. I highly recommend everyone reading that, Radical Remission by Kelly Turner. Of course, there will be situations when the doctor's recommended treatment shows the greatest evidence as the best course of action and aligns with your goals and values. So it's the best treatment that they recommend. You have reviewed the evidence, you have assessed the situation and your goals for your outcomes and your budget and what you are willing to do, and it aligns with your values, and you're like, yes, you agree, I agree, this is the best treatment, let's do it. But if it does not, never feel afraid to speak up and say, no, that's not for me. This is your life, your body, your health. The choice is up to you. So I hope that you found this information helpful. If you would like the references for this information, make sure and sign up for the Loving Health newsletter. All of the references for the articles that I'm writing right now are free and included in the newsletter. And once I get my memberships going for classes, education, and working with people one-on-one and being part of their healthcare team, the references will only be included for members. So I hope you learned a little bit about what true informed consent is, and if you have not been getting informed consent, now you know, and you can make sure that you will be getting complete informed consent from this point here on out. So that's all for today. You can comment below, like and share this video if you found it helpful and you want to send it to someone else who you think might find it helpful. And there will be more information down in the description on Loving Health and memberships and Cooking with Kate classes and all of that good stuff. So I will be back to you next time with more information, and when you know better, you do better, and now you know. Bye guys. Have a great day.